The Prime Minister there seeking to emphasize the point that if India had not gone in for a complete lockdown, the situation by now would have been calamitous. We've dealt with the political and the business aspects of the extension of the lockdown. I want to go across now to one of India's most respected medical voices. Dr. Naresh Trehan joins us. He runs Medanta Medicity, and a lot of people really look up to him for advice on matters medical. I also want to show you right now a thrust analysis of the Prime Minister's address this morning. So we've done 5 word clouds, and the 5 times Prime Minister Modi has spoken on COVID-19. Let me take you through those. I'll start with what the Prime Minister said today. So bear in mind as you see this, what he says, also keep an eye out for what he doesn't say. In the address today, India was stressed 31 times. He spoke of people 8 times. He spoke of coronavirus 25 times. He spoke of problem 8 times. He emphasized 20th of April. 20th, come in closer so you can see this full screen. 20th of April, he emphasized 7 times how it's a global problem is again something that the Prime Minister emphasized, and the need to extend the lockdown was emphasized 12 times over. This is his address this morning. Let's cut back to the second last address from the Prime Minister. This was on the 3rd of April. There he spoke of oneness, light, time. This was when he was emphasizing 9 baje 9 minute. And he spoke of the strength of 130 crore people. That was his second last address on the 3rd of April. Let's rewind further. This is from the 29th of March, where he's speaking about family. He's speaking about the need to be home, to stay in quarantine. He's speaking about thankfulness. He's speaking about hospitals and preparation in the hospitals. Let's cut back further to the previous address on the 24th of March. Here, of course, he's introducing the lockdown, speaking about the need to stay home 12 times over, speaking about family 11 times, speaking about our country 13 times, speaking about infection 11 times. And this is the first address on the 19th, which is when he was introducing the idea of a citizen curfew. Naturally, citizen curfew was highlighted in that address. He explained the pandemic, he explained the need for people to stay home and maintain social distancing. So that's a word cloud analysis done by the India Today team, a live word cloud analysis of the Prime Minister's address. Dr. Trehan, welcome. Good morning. How are you looking at this extension from a medical perspective? A lot of people who are watching you this morning would have expected, especially if they were in the non-hotspot zones, that life would return to some form of normalcy. The Prime Minister essentially saying till 20th, things will stay the way they are. Why is this next 1 week so important from a medical and disease control perspective?
So Rahul, this was essential in our opinion, because we are seeing, if you see last day's 24 hours data also, it is still rising very rapidly. And today we can assess what happened in the last 2 weeks of this lockdown. Now it's almost 20th day actually, that we have been able to slow the curve quite successfully. Now the point is, we are at that inflection level where if we opened up today, say tomorrow is the last day, then what would happen is that whatever gain we have made in these last 20 days could probably be negated very quickly with the surge. So this 2 weeks of extension, I think, is a bold move. It was an essential move because it's a high wire act. The Prime Minister has come out looking very responsible and good in this because of the fact that there are economic compulsions. There's a lot of pressure. Yes, he has taken the bull by the horns and said, look, we will take care of the people who are on the margin, who we are going to make sure their welfare is taken care of, their family's welfare is taken care of. And at the same time, the medical part gets another extension so that we can further control the curve. Because if you look at the experience of the world where the lockdown either did not happen or was lifted prematurely, the curve certainly surged.
But Dr. Trehan, you know, I also spoke to multiple epidemiologists the world over. They said that the lockdown has to have an end game, and the end game needs to be thought out and explained better, because even if, let's assume, on the 20th of April you relax the lockdown and on the 3rd of May you relax it even further, there's a possibility that there could be a hockey stick like inflection even then. Have we thought through the end game enough? What is that end game in your view, sir?
See, philosophical discussion and ground realities are two different things. You can take the view from what the rules are, what the experiences has been, but India is India. India has its own demographics, own culture, own behavior patterns. So whatever we do has to be tailored to India. So if you look at it medically, what will happen? We will get two things. One, we'll be able to do a huge sort of assessment in the next week, because we have, as you have seen the presentation, there are hotspots, there are amber areas, and there are green. Now, if we are effectively able to control the hotspots in the next week, it will give us that advantage that we need today, because with the density of the population, with the diversity of the population, if we were...
Bear with me just for half a moment, Dr. Trehan. I've just received information that the Prime Minister, in a bid to send out a strong message on the need to wear homemade masks, has in fact changed his Twitter profile. This coming from the Prime Minister's office, which says that just minutes after his address finished, the Prime Minister changed the Twitter profile. He's now got a handmade mask, the one that he wore at the start of his address, in a bid to send out that message that homemade masks are the way to go. So, Dr. Trehan, coming back to the question that I was asking, yes, there is the ground reality, but a lot of people have been speaking about how patients will start running thin. People who are watching India today may still be able to survive, but those who are feeling hunger pangs will start getting restless, and therefore ensuring that there is some kind of alleviation to their concerns is also required. What do you make of the non-medical dimensions of the rollout that we've seen so far in the way that you see it, sir?
So this is a balancing act. The fact is, it is our responsibility as a nation, as the government and the people who have the means to take care of the people who are out there who need the help. Now, this is not the time to debate that, because there is no question we need to take care of them. But at the same time, you look at the other scenario. If it was to run rampant across the country, the COVID-19, we would have a disaster of sort of unimaginable magnitude. So I'm saying there is enough data today to show. In the medical community, we have been discussing it ad nauseum, to the fact that if we got another 2 weeks, there would be two advantages. One, that the infrastructure and the supplies and all the other things that we need to take care of patients, God forbid it happens, then we are at least much better prepared. Now, things have started, I must say, the PPEs and the ventilators and all that, their manufacturing has already started in India. When we need 1 million PPEs a day, you need that infrastructure in the country. So that is already now rolling, and I think the next week will give us even that time that we needed. That's two points. The second is the fact that when we know exactly what the community is infected with, because the testing is being ramped up, and it's been only ramped up in the last week. So if we get another week of testing, we'll get the depth of it much better. And all that, and that's why I think this deadline of 20th of April to analyze the data again and do some quantitative easing in. So what will happen is, essential services are already operating. The next step which supports the essential services will be opened after due consideration. Harvesting he talked about, because that's an essential commodity that has to come into the market. So I think when you weigh it against the medical part, and also there is a very interesting element happening, that there is a trial going on in the United States and China on remdesivir, the frontline drug, which Gilead has manufactured in the US. The trials are now at a stage where they will be ending in the next 2 to 3 weeks. So in a way, India is lucky that we are late in coming, and some of the medicines that are being experimented upon or studied around the world are showing promise. So if we get hit, say 4 weeks, 5 weeks, 6 weeks from now, it is possible that we will have frontline drugs available to us to fight it effectively.
But
so I think there are many benefits of it. There was the only benefit of opening up was that you could move the economy a little faster, but the price to pay if we were wrong in that would be so huge it will negate everything for long periods of time.
What
So
do we
in
need
short,
to do, in your view, Dr. Trehan, between now and the
sorry?
3rd of May to ensure that when this lockdown is eased in May, we're able to make maximum use of the time that we've had when India's been locked down, to ensure that we're ready for the post-lockdown scenario? How do we best use this time, in your view, sir?
So if you have been privy to some of the presentation, the government has prepared different scenarios as we move forward. And these are scenarios, medical versus economic. We know that the pain is going to be long. The process will have to be gradual. But ensuring that if we keep this invisible enemy under control, we would have won the battle. I mean, economically, we would recover much faster. If our labor force got infected and then there is a rampant disease, spread of the disease, we wouldn't have any labor to work the factories anyway. So I understand the economic burden. The government has to take the responsibility of, if you look at the curve, of what has happened in the rest of the world. The rest of the world has given 10 to 20% of their GDP as financial assistance right now to tide over this whole event. India has got a plan. It goes up to 13%, which is reasonably good. If the government can loosen the controls on money and let the money flow to where it's needed, and in right measure, I think we can overcome it very successfully. So this is not the time to discuss whether economically it would have been better. Yes, it would have been better. But
Net, and before I let you go, what's your big picture sense? If you were to zoom out and give our viewers, they're questioning, are things going well? Is India on top of the situation? Are things going to spiral out of hand? What's your sense of how the first lockdown was? What's your sense of where we are in the battle against coronavirus at this moment? In your view, Dr. Trehan, are things likely to get better from here on or worse?
Okay. So, in the last week, we have seen the behavior pattern of our communities has changed.
In what way?
In the sense that they are seeing the curve rising and more people getting infected and deaths increasing. So if they did not take it seriously, and if they did not have the means to deal with life on a daily basis, because where to get the supplies, in what order, and all that, they have now understood. So the compliance of lockdown has been much better in the last 10 days than the first 10 days. You could still see marketplaces crowded, people are taking it casually, the youth felt that we are invincible. You know that 50% of the deaths have been below 60 years of age. So there's no such thing as only the older people will be affected. Youth is as vulnerable. So I think these realizations and data as it's coming out has helped. Now, and then Markaz happened. Now, Markaz, the total effect of Markaz will also come out in the next 7 days. So I think all these factors have been kept in place. And also, as you've seen, that the hot spots and the amber spots and the green spots have already been identified. So all this time has helped. The only thing is now, how do we implement it?
So the map that you're referring to is a map that our team put together. That map hasn't been released officially. The green, amber and grey identification is something that the India Day team did. We're hoping that the government will reveal their data as well, but the map that is circulating and spreading very quickly is the map that our team put together. Now, the crucial thing is, how does the government view that? It's likely going to be the same because it's the same data that we're working with, but the government's data is not out in the public domain just at this moment. What you didn't respond to, and I want to draw you in on, Dr. Trehan, is whether you see things getting better from here, or do you believe people have to brace for the worst?
I think it will get better if we are all responsible. And the two things that we really have to do is personal hygiene and wear masks. There are enough examples around the world. You look at the Czechoslovakia experience. They took to masks 100% very early in the game, and they have been able to actually flatten the curve very early, and the number of deaths are minimal. So I think that now that the realization is there that it's important to wear masks, even homemade masks, that panic of that people going and buying surgical masks and then surgical masks running out for the medical providers has vanished, because 3-layer homemade mask is very effective. You can wear it, you can make 3 for yourself, you can wash it with soap and water and do it and soak it for 15 minutes, the virus will die. So I think that there is a lot of currency in what we have learned in the last 20 days. And if an extension will only help us to solidify the whole learnings. And I think hopefully when we open up, we'll be much more responsible. We will have planned it better, because how do you open industry? Do you allow how will the labor travel to their place of work? All these things have to be worked out. There's a lot of work going on. I'm aware of it. And like you said, I think tomorrow the details of the hotspots and all that I'm expecting will be shown tomorrow in public domain, what the government has done.
Dr. Trehan, you have a busy schedule. I don't want to hold you any further. Thank you very much for what you're doing, and thank you for joining us. I hope to have you back again over the next few hours as we get a better sense of what the lockdown really entails. That's Dr. Naresh Trehan, one of India's best known doctors. I'm slipping into a very quick break. When we come back, we'll be joined by the Principal Scientific Advisor to the Government of India. The Prime Minister spoke extensively about the Arogya Setu app. And remember, we've seen big tech being used extensively in countries like China and countries like South Korea and Japan in a bid to contain the virus. What advances have we made? There are 5 crore downloads according to government data. How is the app being used? We'll ask the man who's powering this mission. There's a lot more coming. We'll also get political reactions when we come back. On the other side of a quick break, you're watching India Today's live and continuing coverage of the battle against coronavirus. Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.